Welcome to an introduction of cardiac probe marker orientation in bedside ultrasound. I will start by using an oversimplified example to demonstrate a point, and then we'll go through some of the cardinal views. So let's say I have a patient. My patient has a red right eye. I am looking directly at the patient across from me. From my perspective, I see the red eye on my left side. But I know I see the world 180 degrees flipped. So my left side is the patient's right side. And so I would describe this patient as having a red right eye. And if I wanted to, this is gonna be my patient side, take a picture of this patient, I would take a picture that looks like this. And so when I show this to somebody, they would be like, oh yeah, that red eye is on the patient's right side. That patient has a red right eye, okay? Now, we're gonna imagine cameras are like ultrasound probes and they have markers, okay? So let's say I have my camera set with a marker towards the left, okay? My left, and in this case, the patient's right, okay? This is the final image I wanna show somebody. And so if I were to take a camera, I would also want my camera here, or my probe, to point that probe marker towards the patient's right, because that's the end product I want to show. Now, let's say a cardiologist went up to my camera and put mirroring on as default. So now the probe marker, because it's mirrored, gets flipped 180 degrees. If I didn't know that and I took the picture with this same setting, I would come out like this. Now, the funny thing about cardiologists is even though their machines are flipped 180, they still want to see all the pictures the same way the rest of us do. And so when they looked at this picture, they'd be like, uh-oh, that patient has a red left eye. And you're like, no, you flipped the camera on me. And they're like, no, but you gotta flip it backwards for us. And so this obviously is miscommunication, and this would become a medical error. So if I know this is my final product that I want to get, and the probe marker on my machine is pointing towards my right side, and thus the patient's left side, I would flip how I scan the patient so that I'm scanning with my probe marker on their left side, right? So now the machine is backwards, okay? I'm scanning them backwards, but because they're both in agreement, they're both backwards, the image turns out exactly the way I want. And that's, this entire concept is what we're gonna do for the heart, okay? So let's do the same example where this is the patient and this on the right side is the output on my screen, all right? So let's start with a parasternal short axis, okay? This on my screen is exactly what I wanna see. Whether I'm a radiologist, whether I'm an emergency, whether I am a cardiologist, I wanna see on my screen my right side being the LV and my left side being the RV. And I expect to see, again, something bigger on my right side. If I was staring at my patient, right, I'm looking directly at them, their LV would be on my right side and their RV would be on my left side. So if I had my machine settings in a traditional POCUS view where it's on the left, okay, notice in this view, the probe marker is on the same side as the RV, or the patient's right. So to create this image, I would bring my probe, again, I'm kind of diagonal on their chest, but I'll bring my probe towards their RV, all right? So when the marker is on my left, I point towards my left. A better way of thinking about it is when it corresponds to the right side of the patient, I'm scanning with the probe marker to the right side of the patient. Now, if your machine was on cardiology mode and the probe marker was on the right, your right, my image still has to look like this, right? Cardiologists still want to see this orientation. So what I do is I flip my probe 180 degrees. So now I'm scanning, again, probe marker to my right, probe marker to my right, or probe marker pointed towards the LV, probe marker pointed towards the LV, or to simplify it, people say if you're in cardiology mode and you want a peristernal short, you want to point towards the left shoulder, right? Because I'm pointing this way towards left shoulder. We're all saying the same thing here. This is the final product. This is how you get it if you're in cardiology mode. And if you're a traditional radiology POCUS mode, you just flip backwards. All right? Now, let's get a little more complicated. Let's say now I want an apical 4-chamber view. Apical 4 chambers, again, whether you're radiology, emergency, cardiology, any specialty, you want to see it in this format, right? Where the LV is on the right side and the RV is on the left side. And you can imagine if someone showed you the opposite, you'd be very confused and be like, wow, that is a big RV, when in fact, we're just looking at the LV, okay? This is the orientation you want. If you're on a traditional radiology or POCUS setting, and your probe marker is on your left side, you'll notice it corresponds to the RV. So if I was scanning this patient coming from lateral at the apex of the heart, kind of the side lower wall of their chest, I would want my probe marker also towards their RV or their right side. So you'll notice the image, because we're coming from down up, is a up and down reflection of real life, right? Because on the screen, I see LV on top. In real life, LV is towards the foot of the patient, but I'm coming from below. So it's an up and down rotation, but the side to side still maintains the same orientation. As in, probe marker to my left, probe marker is still to my left, points towards the RV, and it points towards the RV here, right? And if you were on cardiology mode, where now you're pointing towards my right, or the LV, I would just flip it here. So now I'm scanning from below, probe marker on the right of the screen, on my right, pointing towards the left of the patient, or the LV, points towards the LV here, okay? So cardiology mode, apical 4-chamber, traditional radiology mode, 4-chamber. Now we'll get to the most confusing one, but don't worry, you will get this too. And that is the peristernal long axis. So the peristernal long axis, no matter what view you are in, has to look like this. People expect to see the LV on the left side and the RV, aortic outflow tract, and LA on the right side. This is just how a peristernal long is. You'll notice if you look at a patient and you're looking directly at them, their LV is on their left side, and thus the right side, this is the right side of my visual field if I was looking at them. You'll notice these images are already flipped. A correct peristernal long is effectively 180 degrees flipped of how you look at a patient. And again, we're looking at patients kind of face to face, looking at them. If you were, say, at the head of the bed, looking down on their feet, and let's say you were intubating them, or you were doing, let's say, a central line, when you look at a patient this way, now their LV is technically on your left side. This is how traditionally the peristernal long was developed, but because we don't perform the peristernal long axis scanning at someone's head, we scan facing the same direction as them. This becomes very hard to cognitively think about, which makes it, in my opinion, kind of the hardest view to think about orientation. But let's work through this step by step, okay? If I was in a traditional radiology mode, my probe marker would be pointed towards my left, which in this case is actually pointing towards the LV of the patient. All right, so it's my left, but also the patient's left, okay? So typically I'm cutting it diagonally. I'm using my probe marker, I'm cutting it diagonally like this. But for our purposes, I'll show it to you this way. All right, if I was pointing to the LV, or the left side of the patient, I surprisingly have my probe marker this way in a traditional radiology mode. So probe marker to the patient's left, pointing towards the apex of the heart. This is how you get a personal lung. And again, I'm coming at an angle, and so even though my heart's rotated, it comes out on the screen like this, or it should. If I was in a cardiology mode, and we're now pointed towards the right side of the heart, I would on my patient just flip this backwards, like this. So now my probe marker is towards their right, which is how it should look on the screen. And that's why people traditionally describe getting the peristernal long axis pointing towards the patient's right shoulder. So in cardiology mode, this is how I think about it. In cardiology mode, I want the probe marker away from the LV. So I scan my probe marker the furthest away from the LV. If I was in a traditional radiology POCUS mode, now I want it towards the LV, like this. And you'll notice, because the view is 180 degrees flipped from all the other views, this is a little jarring, right? Probe marker on my screen is to the left, but when I'm doing it in real life, it's pointing to my right. They're kind of conflicting. Same thing in cardiology view. If you're pointing towards away from the LV, you would scan away from the LV. These are on opposite sides. Because this is a backward scan, this is the orientation you do. It's weird, but the final product always comes out like this. And this is how all people like to look at a peristernal law. Okay, I hope that was somewhat helpful. I think once you get the blueprint down, most of this is gotta be just bedside, scan, scan, scan. And after 10, 100 times, this is gonna click and make sense for you. So good luck and happy scanning. Thanks.